Welcome to this explainer. Today, we're putting on our Ayurvedic researcher hats to look at a genuinely fascinating intersection of two very different worlds. We're going to evaluate exactly how an ancient herbo-mineral formulation holds its own against a modern, widely used antihistamine in the battle against chronic allergies. So, if you've ever found yourself wondering if traditional systems actually have a measurable scientific place in modern clinical care, well, you are absolutely in the right place.
Let's kick things off with a pretty fundamental question. Can ancient medicine actually cure modern toxicity? I mean, we live in a world that is just totally packed with synthetic chemicals, and our bodies are constantly reacting to this modern environment. But what if the secret to managing these hyperallergic reactions was actually documented centuries ago?
Just to wrap our heads around the sheer scale of the problem, a staggering 20% of the global population suffers from urticaria, commonly known as hives, at some point in their lives. And very often, these really sudden, frustrating outbreaks are triggered by latent environmental toxins that have just been quietly accumulating in our systems.
Now here is where it gets really interesting. Ayurveda has this concept called Dooshivishya, which translates to a slow-acting, latent poison. So unlike an acute reaction, say a snake bite, Dooshivisha is all about bioaccumulated toxicity. It's mild, it builds up slowly over time, and it gradually wears down the immune system until it finally manifests as severe skin diseases like Kotha, which of course is what we recognize today as urticaria.
So, here's our roadmap for today's explainer. First, understanding latent systemic toxins. Second, the pharmacodynamics of Dooshivishari Agada. Third, the clinical trial setup. Fourth, DVA versus cetirizine efficacy. And finally, limitations and future research.
Part 1. Understanding latent systemic toxins.
The common sources of this Dooshivisha are actually just everyday items. We're talking food additives and preservatives, agricultural pesticides, everyday cosmetics, and of course air and water pollution. The really crucial point here, especially from an Ayurvedic researcher's perspective, is that chronic, daily exposure to these substances leads to a condition called shoneda dushti, or blood vitiation. Essentially, the blood gets compromised, ultimately setting up an allergic hypersensitivity that is just waiting for a spark to set it off.
And when those latent toxins finally do get triggered, maybe by a sudden dietary change or a spike in environmental stress, they produce these highly unusual immune responses. The result is Kotha. The classic presentation includes mandala, those really frustrating circular patches, kandu, which is severe itching, and raga, or red rashes. It's basically a massive systemic blockage manifesting right there on the skin.
Part 2. The pharmacodynamics of Dooshivishari Agada. To tackle this, we're looking at DVA. It's a complex polyherbo-mineral formulation. The raw botanical and mineral ingredients include things like Pippali, Mamsi, and Suvarchika. And for the sake of this clinical study, it's super important to note that every single one of these raw drugs was strictly authenticated and standardized for purity before they were ever processed into tablets.
All right, this is where the magic happens. When we compare the traditional Ayurvedic properties with modern pharmacodynamic actions, we see some amazing parallels. Pippali, for instance, actually acts to stabilize mast cells. Musta serves as an incredibly powerful anti-inflammatory. These compounds are designed to work synergistically to target deep systemic imbalances. So rather than just slapping a Band-Aid on a localized histamine reaction, they provide rakta shodhana, meaning blood purification and immunomodulation, to actively prevent further hypersensitivity from happening in the first place.
Part 3. The clinical trial setup. So, the researchers wanted a direct head-to-head comparison. They set up Group A as the standard control, giving them 10 milligrams of cetirizine, which is a very standard modern antihistamine once daily. Then, Group B, the experimental group, received 2 grams of the Dooshivishari Agada tablet every day in divided doses, taken with honey. Both cohorts had exactly 15 patients, and the whole study was designed around a 30-day treatment period followed by a 30-day follow-up.
Now, to maintain absolute clinical integrity, the researchers used some really tight inclusion and exclusion parameters. They specifically needed to isolate chronic urticaria that was caused by those latent systemic triggers we talked about. So they naturally excluded pregnant or lactating females, as well as patients whose symptoms were caused by direct allergic contact dermatitis or hereditary edema. Basically, they needed a pure sample of patients suffering specifically from accumulated toxicity.
Crucially, the researchers didn't just walk in and ask the patients how they felt subjectively. I mean, yes, they did track the wheals, the itching, the pricking, and the burning, but they went a step further with objective urticaria activity scores, and they rigorously tracked laboratory blood parameters. By actively monitoring the total leukocyte and absolute eosinophil counts, they could actually observe the deep systemic immunological impact of both of these treatments over time.
Part 4, DVA versus cetirizine, efficacy.
The results here are just fascinating. For the most debilitating symptoms, Kandu, the severe itching, and Daha, that awful burning sensation, both groups saw highly significant relief. No clear loser there. However, when you look at the physical manifestations, cetirizine definitely demonstrated a faster, more measurable impact on the physical wheals, the mandal, and the pricking sensations, the tota, within that initial 30-day window. So for rapid symptom suppression, the modern antihistamine definitely took the lead.
But hold on, let's take a look at the blood lab results, because this is where the systemic story really unfolds. The labs objectively report that while cetirizine was far superior in reducing absolute eosinophil counts, which, remember, are direct markers of an acute allergic reaction, the Dooshivishari Agada actually showed a much more significant improvement when it came to reducing the total leukocyte count.
And honestly, this right here is exactly what an Ayurvedic researcher is hoping to find. It strongly indicates that DBA isn't just acting as a quick-fix antihistamine. Instead, its herbal ingredients are actively getting in there and addressing the root cause by regulating the systemic immune response against those latent toxins. It literally breaks the pathogenesis of urticaria by functioning as a deep tissue antioxidant and a powerful immunomodulator.
Part 5. Limitations and future research.
Now, as objective researchers, while the results we just looked at are highly encouraging, we definitely have to acknowledge the limitations. The study had a pretty small sample size, just 15 patients per group. It was also limited in demographic scope, since it was conducted in a single geographic hospital setting, and it relied on a relatively short active treatment window of just 30 days. Because of all this, it's best to view these findings as a very strong pilot study rather than some definitive global conclusion.
So, to fully validate these herbal findings for chronic urticaria, the medical community needs to follow a clear roadmap. Number 1, execute randomized trials with significantly larger sample sizes. 2, expand the demographic scope across multiple clinical centers to see exactly how varying populations respond. And 3, conduct further advanced phytochemical standardization of the raw DVA formulation to guarantee absolute consistency from batch to batch. The clinical researchers themselves actually hit the nail on the head in their conclusion. They noted that the ancient formulation works powerfully, particularly on a systemic immunological level, but, and this is a big but, modern clinical validation with larger samples absolutely must continue.
I want to leave you with this final thought to ponder. If we live in a world where we are constantly, inevitably accumulating environmental toxins, our very own modern Dooshivisha, shouldn't our medical approach evolve alongside it? Is it time we look beyond just suppressing the surface symptoms and actually integrate treatments designed to purify and restore the whole system? Thanks so much for exploring this fascinating topic with me. Keep asking questions and keep learning.